Hello, in this tutorial, we are going to visualize pericarditis interpretation on the ECG. So for pericarditis interpretation on ECG, in order for you to evaluate the different elements of the ECG interpretation of pericarditis, you should know the stages of pericarditis. Pericarditis has different stages. It starts from stage 1, then it goes to stage 2, then it goes to stage 3, then it goes to stage 4. There are 4 stages of pericarditis. So in the stage 1, you have what is called PR depression. You have the PR depression and the PR interval depression. That's 1. And then the second element is an SC segment elevation. Is it clear? PR interval depression and SC segment elevation occurring in stage 1. Is it clear? Now, let's understand the PR interval depression segment elevation. The most important aspect of that is the SC segment elevation. Is it clear? So let's understand the SC segment elevation. For SC segment elevation, is it clear? The first point that you have to put in mind is that what is the difference between the segment elevation in the pericarditis from that of myocardial infarction? For a segment elevation in pericarditis, you are going to have the first point, you have a concave elevation. So when you have a concave elevation of the SC segment, it is going to be more of a pericarditis than a myocardial infarction. The second point, if you have a diffuse, when you have diffuse SC segment elevation, it is much more for pericarditis than myocardial infarction. Is it clear? So when you have concave elevation, you have diffuse elevation, it is much more of pericarditis than myocardial infarction. So how do you evaluate this concave? So let's say that you have a P wave here, then you have a QRS complex. For a case of a convex elevation, it's going to be elevated in this direction. The G point is going to be convexing. Are you getting? Are you seeing the G point? The G point convex, then you have the SC segment, then the T wave can be inverted. Is it clear? So are you seeing? Then the next one is in a case of a concave myocardial infarction, a concave elevation, a S segment elevation. So for concave S segment elevation, let's say that you have your P wave, then you have your QRS complex. Then in the case of concave, it's going to be concave. This is how the G point is going to resemble. So it's going to be concavely elevated as such, and the G point is going to be as such. Then you have your SC segment. Is it clear? So that is a concave elevation of the myocardial infarction, while here is the concave elevation of the SC segment, while here is a convex elevation of the SC segment. Is it clear? So that is what occurs in the case of the pericarditis. And now pericarditis, these are also diffuse. The next element is in stage 2. You have restitution of the PR interval and you have the restitution of the SC segment. So the restitution of the PR interval means that the PR interval go back to the baseline, is no more depressed, and the SC segment go back to the baseline, is no more elevated. Now in stage 3, you have an inverted T wave. Is it clear? In stage 3, while in stage 4 you have restitution. Is it clear? In stage 4 you have restitution of the T wave. Is it clear? Restitution of the T wave. So those are the different elements that you have to evaluate when you are visualizing pericarditis on ECG. Now, the next thing that you have to visualize after pericarditis of ECG, you have pericardial effusion. Is it clear? Pericardial effusion. Now, for pericardial effusion on ECG, how does it present? Generally, pericardial effusion on ECG just presents with microwaves. Is it clear? When you have microwaves on ECG, you have pericardial effusion. Normally, the P wave should be half. The P wave should be half that of the P wave should be half the big square. Is it clear? But if it is smaller than that, you have a microwave. Is it clear? And the QRS complex normally have to be up to 5 millimeters, particularly at the level have to be up to 5 millimeters, particularly at the level of the limb lead 2. Is it clear? So if you have a QRS complex that is less than 5 millimeters, particularly in limb lead 2, and also reduce all through the leads, it can show microwaves of pericardial effusion. Is it clear? So generally we have other causes of microwaves, like in the cases of obesity, like in the case of skeletal malformation, where like in the case even of a COPD, where you have air in the chest and then it increases the distance from the heart. Is it clear? So anything that can reduce the impulse, anything that can reduce the impulse recognition, or the impulse anything that can reduce the impulse recognition from the heart to the lead is going to produce the microwaves. We said pericardial effusion, we said obesity, we said even COPD, congestive obstructive pulmonary disease, where air is inside the chest and it's going to reduce the impulse transmission to the leads that result to the microwaves. Is it clear? Now, the next thing after that, you have how to visualize congenital heart disease on the ECG. Generally, congenital heart disease is going to be based on the different pathology that we have already seen. Is it clear? But the major congenital heart disease that I want us to see is the tetralogy of Fallot. Is it clear? Tetralogy of Fallot. Now, in tetralogy of Fallot, there are different elements in tetralogy of Fallot. The first element is pulmonary stenosis. Is it clear? Pulmonary stenosis. The second element is the ventricular septal defect. Is it clear? Second element is ventricular septal defect. The third element is the overriding aorta. And then the overriding aorta, and the fourth element is the right ventricular hypertrophy. Now, you have to know that right ventricular hypertrophy is a major sign that can be visualized on the ECG. Is it clear? And you have the R all over the S that is going to be greater than 1, and you have the R where is going to be greater than the 7 millimeters. All that is going to tell you for right ventricular hypertrophy. Now, for pulmonary stenosis, similarly, is going to be shown with right ventricular hypertrophy and also right axis deviation. You're going to visualize also right axis deviation in the cases of tetralogy of Fallot. Is it clear? So those are the different elements. You cannot visualize ventricular septal defect on the tetralogy of Fallot, and you cannot visualize overriding aorta in the tetralogy of Fallot. Is it clear? So on tetralogy of Fallot, you can visualize right ventricular hypertrophy, you can visualize right atrial deviation, right axis deviation. You can also visualize even right bundle branch block. So all these are the disorders associated with pericarditis, pericardial effusion, and congenital heart disease, particularly tetralogy of Fallot. Now we continue with the next part. Please don't forget to like and subscribe for our channel, Science Video Makers. Thank you.